The posture of your feet affects how your knee and hip aligns, and as a result, where the forces impact the body. In a normal arch, the ankle joint is in neutral, which keeps the lower leg straight, the knee joint neutral, and the thigh and hip joint neutral. When your arches fall inward, this causes your ankles to collapse downward, your knees to fall inward, and your hips to turn inward as well. This can cause hip pain in multiple ways. First, muscles in the hip will work extra hard to try and fight the inward rotation of the hip. This forces the outward rotators of the hips to be constantly tightened to try to get the hip back to its neutral position. These muscles are the deep rotators of the hip, such as the piriformis, superior and inferior gemelli, obturator externus and internus, and the quadratus femoris muscles. The constant tension in these muscles will lead to pain and discomfort in the hips. Second, when your hip is turned inward, it changes where the forces of the hip are distributed in the joint. This can cause extra wear and tear in the joint structures, such as its cartilage, which can contribute to pain and arthritis of the hip. Third, the arch is a natural shock absorber of the lower limb. Without an arch, the body's first line of shock absorption as the foot lands on the ground is compromised. This leads to an extra impact on the tissues surrounding the ankles, knees, hips, causing pain in any of these areas. There are exercises you can do to help minimize the pain and strengthen the muscles to help realign your hips. All stretches should be held for 30 seconds and repeated 2 to 3 times. Lay on your back with your knees bent and cross one ankle over the opposite knee. If you already feel a gentle stretch in this position, hold it here and gently push the knee of the bent leg down. To increase the stretch further, lift the legs up towards your chest. Laying on your back, bend one knee and bring it up towards your chest to the opposite shoulder. If you feel an uncomfortable pinch in the hip area, roll up a small towel and place it right in the hip area before pulling up the leg. You should feel a stretch on the outside of the bum area. In a seated position on the floor, bring the soles of your feet together. If you are really tight, you can start with the feet farther away from you. The more flexible you are, the closer you can bring the feet towards your body. Find a comfortable position and lean the upper body forward. Lay on your back with your hips and knees bent at about 90 degrees. Bring the bottom foot up and rest it on the top knee. Feel a stretch on the outside of the hip. You can vary the angle of the hip to find the position where you feel the most stretch. All strengthening exercises should be done 10 to 15 repetitions, 2 to 3 sets. Lay on your side with knees bent. Place a band around your thighs. Tighten your core and lift open the top knee. Imagine squeezing the bum muscles as you open the knees. Slowly return to the start position and repeat. Sit in a chair and detach one end of the band to something stable. Loop the other end around the ankle. Keep the thigh on the chair, turning the lower leg inward. Place a band around the thigh and make sure there is decent tension on the band. Bring one leg out to the side, then bend the hips and knees to squat down. Make sure the knees do not collapse inward and stays in line with the first 2 toes as you squat. Return to the start position and repeat it on the other side. If you're not sure whether you're doing your squat correctly and you want to start easier, click on the link above to watch our video on how to master the sit to stand exercise before progressing the squat. Finally, if you haven't already tried orthotics, check out our video here with a step-by-step guide on figuring out whether you should spend money on custom orthotics, or if simple off-the-shelf orthotics will be enough for you. Thanks for watching. Until next time.